Let's clear a concept of Huntington disease. Huntington disease basically autosomal dominant, increased number of CAG repeats, nucleotide repeat anticipation is present, and gain of the function mutation, protein accumulation toxic to neurons, and there is a decrease in GABA and acetylcholine action in caudate nuclei, and clinical features include chorea, involuntary jerky movements, face extremities, behavioral abnormalities, aggression or depression, progressive dementia, and for the confirmation we do genetic testing that can show the CAG repeats, that is a trinucleotide repeat sequence, and neuroimaging can show caudate atrophy with enlargement of lateral ventricles. So this is the point where we pick the answer caudate atrophy along with the putamen atrophy along with the enlargement of lateral ventricles. So this is our required answer. And as in compared to this phenomenon, diffuse ventriculomegaly without sulci widening is seen in normal pressure hydrocaph. Remember that it is seen in normal pressure hydrocaph. That can lead to urinary incontinence, gait disturbance, cognitive impairment, and increase in CSF volume. So in contrast to this, we have hypoplastic cerebellar vermis with cystic dilatation of fourth ventricle and posterior fossa cyst. So this is the characteristic of Dandy-Walker malformation. Although the diagnosis of Dandy-Walker malformation can be delayed into early adulthood, patients typically have long history of chronic headaches and neurological abnormalities. So early onset Alzheimer's disease, in this case Alzheimer's disease, there will be bilateral hippocampal atrophy or frontotemporal dementia. Frontal temporal lobe atrophy can be present in such patients as early as the 4th decade. So there will be the changes in memory, speech, behavior. Predominant symptoms include presentation, movement abnormalities like myoclonus, akinesia, hyperreflexia will be seen in such patients. So this is the quick concept and a comparison between Huntington disease, Dandy-Walker disease, Alzheimer's disease, and normal pressure hydrocaph.